Hi, Mitch.
Hi, Dr. Raman.
Well, I want to do a quick update of where we are today. We just finished fine-tuning the bite after your full mouth reconstruction. This is March 7, 2014.
Right.
So briefly, tell me about your journey through all this.
Well, I came in with a lot of mouth and jaw pain, and
That was back in right after Christmas of 12.
that's correct.
Yeah.
Yeah, a little over a year ago. And you explained everything in detail. We chose to do the full mouth reconstruction.
Well, I know that's a little later, but let's before we jump to that one, you're from Tyler, Texas. What
Correct.
made you come all the way to Kansas City?
I did a lot of research on the internet. I've been through quite a bit of dentistry work and
Tell me.
orthodontics and surgeries, and I just searched. And
What are the kind of, over how many years?
since I was 10 years old.
And how old are you now?
That'd be 45 years.
Okay,
I'm 55.
okay. And you had what kind of surgeries?
They reconstructed my jaw.
Jaw surgery, uh-huh. And then you also had a neck surgery,
Correct.
okay? And then what other things that you had done?
I've had crowns and root canals and root implants.
You had 5 implants, 2 on top and
Right.
3 on the bottom on the same side, left side.
Right.
Tell me about those. Were there implants done for what reason?
The root canals had become infected, and they had found that I was continually having infections in my sinuses and other problems. And so I was told I needed to have those teeth removed. They removed those teeth, and about 5, 6, 8 years later, I was removed. I wanted more.
Yeah,
teeth
speak
on
up a
the
little bit,
left side. I wanted teeth on the left side, so they did some implants.
Okay, so tell me about that. What happened afterwards?
After the implants,
Yeah, and about how many years ago was that done?
I can't recall. It's, okay, about 2009,
Okay,
I think.
all right.
That's when the implants were.
So by the time you saw me, that was 3 years.
Right,
Okay.
right.
And what happened afterwards?
The implants seemed like the teeth were just a little short. My jaw didn't seem to be lining up well. Had pain in my jaw that was getting worse and
Where
worse.
was the pain at? Would you point to me?
Mainly the left joint.
Jaw joint, okay.
Yeah.
And what was the conclusion at that point?
Here,
No, before you found me, I think you went to the surgeon that did your surgery.
yeah, he told me I needed a jaw joint replaced.
Dr. Hammond
Correct.
in Tyler.
Right.
Okay. And what was the reason he said you need joint replaced?
It was worn out. The joint was worn out.
Okay. And quick background, you're an engineer and an attorney as well, as far as your
Right.
background.
I worked as an engineer for years. I'm a geologist. Yeah.
I see. So I'm guessing that explanation didn't make a lot of sense to you?
I didn't think it made sense because nothing else seemed to be working over the years. I was told the jaw surgery would cure my grinding problem and my pain. I was told over and over again something else would cure it, and so I started researching.
Okay. All right. Fast forward and you saw us in 2012, right after Christmas, and then for a consult, came in for a long day, and then what were you thinking afterwards? And what were the...
Well, I did a lot of praying and reading and hoping that maybe this solution would work, since I tried so many other things that didn't.
Besides, something must have made sense to you. You're pretty intelligent. Something must have made sense to you to decide this made sense. Like
Well,
neuromuscular dentistry made sense.
In all the reading and all the reviews and all the medical stuff I read, it just made sense that the way they were fixing the jaw didn't work.
Okay.
And this made sense from a physiological standpoint. So
Got it. All right. We did a lot of measurements and so on. And what did we do first? Do you remember? That would have been February of 13. We did the orthotic first.
yes, you did.
So we basically a trial basis.
That's right.
So I didn't want you to take my word for it. You wanted to see,
the teeth back, height of the teeth, and readjusted the bite jaw slightly.
aligned it where it ought to be. And what did you feel afterwards?
I felt some relief in the joints,
Okay.
and the grinding seemed to decrease quite a bit.
Yeah.
For the
And
first
I
time in
think
my life.
first time in your life? Yeah, I seem to think, okay, I think we delivered on a Friday and then Monday goes, you went something like, the first time I felt good in this in a long time.
Yeah.
I see. And then, of course, you had a few options, and not too many options. We can only give you a couple of options because you had some implants already. We can't move them.
Right.
So you chose the full mouth reconstruction option.
Right.
And we just got that one done last week. We're doing the fine tuning today. How does it feel?
It feels really good, and it looks really good, so doubly wonderful so
Well,
far.
Good. Well, part of why we do these things is because people hear so many things, and it becomes like one doctor's idea versus the other. It seems like a lot of theory.
Mhm.
So that's why real people that go through real things make a lot more sense to real people. So if somebody was listening to this one, they're going through a joint problem and they're saying, oh, you need surgery, nothing but, what would you tell a person like that?
I would tell them to come talk to you and see if there's other options that make more sense, because it may just be a bite misalignment that's causing all the issues.
Yeah, good. And you have, I know it took a little longer because you had some health issues in between. It would have been done a little quicker otherwise. But you spent a lot of time, a lot of travel, a lot of money to get all this done. Now that you know what you've gone through and all that, what are your thoughts on all that expense of your time and energy and money?
Well, it's worth it. The only thing I would change is to move you closer to my home.
It is a bit of a drive, I understand. A 2.5-hour drive to Dallas and then catch a flight?
Yeah.
Yeah. Well, it's been it's a blessing for us to be able to help people like that.
Yeah. And at least you're centrally located, so that's good.
Thank you so much.